The expressed views, statements, and opinions by the guests on the Risk Advisor program made either during the show or on the corresponding social media and blog outlets are not necessarily the view or opinions of Baxter Productions, Inc. or any of its affiliates, associates, or others who are part of this production. Information provided during this broadcast is for news purposes only and does not constitute a remedy for any of the discussed risks presented.
You ever wonder how many people consider plastic surgery? According to a New York Daily News report on plastic surgery, 1 in 5 women say that they're actively planning or considering to have plastic surgery. With an estimated market of more than $75 billion, the trend to seek help from a cosmetic doctor is on the rise by more than 200%. What are the risks and what you should consider before having that surgery? That's what we're going to talk about today on theriskadvisor.com.
The Risk Advisor. You're listening to the Risk Advisor podcast. The Risk Advisor highlights topics about the most important personal security and safety issues today. This is for you, your family, and your loved ones. Experts alert to trends, tactics, and techniques used against us. You can be more aware and more informed to stay safe in this ever-changing, complicated place we call life. And now your host, media's go-to guy, Sal LaFriere.
Welcome to the Risk Advisor podcast. We're with Dr. Maria Lotempio, who is a double board certified surgeon in plastic and reconstructive surgery and head and neck surgery. She was born in Buffalo, New York, and started her medical career first by entering the field of nursing, working as a neonatal intensive care nurse. She later realized her goal to become a surgeon and early on graduated from the State University of New York at Buffalo School of Medicine. She was accepted to the prestigious UCLA Head and Neck Residency program, working exclusively in cosmetic and reconstructive procedures. Dr. Lotempio, welcome to the show.
Thank you. It's great to be here today.
So, we gave them a brief overview of yourself, but tell us a little bit more about you.
Well, I always knew I wanted to be in the medical industry, and when I was very young, I found that the head and neck anatomy was really something I excelled in. So as a nurse, I was just really fascinated with it. And after working as a neonatal ICU nurse for a year, I decided to go on and go into medical school, and I fit right into surgery. I love doing small procedures, and I love doing large procedures on small things.
Did being a nurse help you along the way? I mean, in medical school, was it sort of like a primer?
It does help you tremendously. The first 2 years, not so much, because the first 2 years are really all academics and sitting in a classroom and just taking tests and studying. But the second 2 years, when you're actually talking to patients and interacting, tremendously, the nursing background really gave me an edge.
So, according to this report that was in the Daily News, one of the articles, and it talked about people going to cosmetic doctors, and that the rise is about 200% a year is what's been going up. Do you see that rise? Are people going to cosmetic doctors? Well, what is a cosmetic doctor?
Well, they are, and that's a great question, because cosmetic doctors are not necessarily plastic surgeons that are board certified. Cosmetic doctor can be really anyone. It could be an OBGYN, it could be a family doctor, it could be a dermatologist, internist. When they say they've completed a cosmetic board, they're saying that they actually went to a 12-month criteria of learning. They never took any exams. They're not recognized by the United States as a formal board of surgery. So those people just have a very limited experience. The ones that have gone through a general surgery or an ENT residency and then gone on to do plastic surgery or a full plastic surgery residency that requires them to actually perform well in exams that are both written and oral and to become board certified. Those are the surgeons that could really advertise as aesthetic and plastic surgeons.
Wow, I wonder how much of the public actually realizes the difference between that.
They don't, and a lot of them don't answer. Those questions are never answered to them, and nor are they ever asked. They feel that if someone's been in this criteria or been in this field, they just take it for granted that they're obviously trained and they're obviously educated and they've fulfilled all the requirements. And it is a dangerous precedence that consumers are not doing their research and not looking to make sure that their surgeon that they're going to, that is their essence, putting their lives in that person's hands.
You know, it's moments like this that I wish the show would really an hour, because I just got 1,000 questions about this.
Yeah.
But let's try and narrow this down a little bit. So I'm going to decide that I want to have plastic surgery.
Sure.
How do I find a doctor?
Well, I think the best thing for the consumer to do is to start on the internet, to talk to their friends. You know, what procedure do you want? Do you want to go to somebody that is well known in that one procedure? Do you want to travel? Do you want somebody locally? Once you kind of narrow it down, do you want a female? Do you want a male? Then you want to look at their background. They want to look at their education. Are they board certified? Have they passed their exams? Are they affiliated with hospitals? Because usually if they're affiliated with the major hospitals, they've gone through all the criteria in the United States to be considered a safe and effective surgeon.
So when you actually sit down with the doctor, right, what are those questions that you want to ask? So you should do all your research first, and then you sit down with the doctor. Is it basically seeing if they're giving you the same answers, or is there other things that you would want to look at?
All those questions that we just talked about can be answered before they even come face-to-face with the doctor.
And then you sit down, you talk to them. I mean, in my world, out of the law enforcement world, we never ask a question we don't know the answer to, right? So,
somewhat.
So now we go in, we sit down with a doctor, and we've done our research, we've done our homework. Do we now just double check on what they're...
So now you talk to the person and you find out, you know, is their personality something that you can get along with? Or do you feel comfortable telling this person problems? Do you feel that this person's knowledgeable? Are they going to answer your questions with the real answers, or are they kind of giving you a sort of made-up answer? Or basically, are they just trying to sell you? Are they trying to close the deal? So when you're talking to a plastic surgeon for their first time, I think it's fair to say and ask, how many procedures have you done? You know, what is your percentage of complications? But more specifically, what are your complications? What are your major complications in the last year with this procedure I'm interested in having?
Is there any sites that a person who's contemplating plastic surgery should be going to? I know later on we're going to get into talking about social media and the issues and problems that that's going to raise, but for a general research, what are the areas that you think someone should, would be a good place for them to go to?
There's so many different areas on the internet. I mean, each doctor should have their own website. There's something called therealself.com. There's a bunch of things, vitals.com, healthgrades.com, a bunch of things that the consumer can actually go in and actually do their research to find out more specifically about the physician that they're seeing.
I would have to believe that one of the most difficult parts of it is setting expectations. We see it in my practice that, trying to establish what the expectations are and what the client wants us to achieve. In your case, it's got to be incredibly difficult. I come walking into your office and I'm saying that I want this particular nose or I want this particular look. Is that something that's always achievable? How do you set expectations to the patient?
It's a very difficult question to answer because at the end of the day, plastic surgery is a cash business. The idea for the surgeons is to seal the deal, close the deal, get the patient to commit to surgery. So when oftentimes they're like that, they may not be 100% truthful with the patient. They may minimize certain things. Whenever a patient comes in with a picture and says, I want to look just like that, it's very difficult to promise that.
Now, those are pictures that basically they're getting out of social media, right? And they're looking at, they're seeing a celebrity or a star or someone.
Magazine, yes, anything.
And saying, I want that nose, I want that, that eye line or whatever.
Sure,
I want
sure.
those cheeks.
And we can do within reason to make them look like that. But at the end of the day, I always tell my patients, I can only set up so much. It's your body that determines how you heal and how you look. So I can give what you need, but then you're going to have to take it and somewhat bring it home. So if you don't heal well and you heal in a different way, I still did my part of the job. Now, that's the part that patients sometimes find difficult, is the actual healing process, because I have no control over that.
Wow. Okay. We're going to take a quick break, and when we come back, we're going to talk about the fascinating psychological condition that affects some women who've breast cancer survivors. And instead of the Me Too, this is not for me. We'll have more when we come back.
Workplace violence, terrorism, identity theft, cyberbullying, and stalking. It's not a matter of if they will happen, it's a matter of when. The security world is too complicated to do it alone. You need a security advisor. Call Protective Countermeasures now. Protective Countermeasures has been providing security consulting to Fortune 500 companies for nearly 20 years. Call today, 914-576-8706, protectivecountermeasures.com.
We're back. You're watching the Risk Advisor Vodcast. We're with Dr. Maria Lotempio, a board-certified New York-based plastic surgeon specializing in reconstructive and cosmetic surgery. One of the things that we wanted to talk about was this psychological condition, but I think, as we were saying in the break, research of where patients can go. Where do you think they should go?
Right. I think the first place they actually should start at the American Board of Plastic Surgery website, where they can see if the patient or their plastic surgeon has completed the criteria to become in America board certified. They also should look at the American Society of Plastic Surgery and Reconstructive Surgeons, and that will also tell a little bit more about the background of the surgeons.
Okay. Let's talk about this. One of the things that was just absolutely fascinating in pre-production meetings on this that came out was we were talking about the women saying, not me, I'm not entitled.
Right.
Talk to us about that.
So I think we were talking about patients who have undergone breast cancer treatment or just cancer treatment in general. I think a lot of them have felt that, you know what, I'm lucky to be alive, and I really shouldn't push having cosmetic surgery because I should be thankful I'm cured or I'm in remission. And it brings really a quandary to that patient, because why shouldn't they look as best as they do and want to look regardless of the disease that they've had and treated? So I think it's a dichotomy with them is, should I really get Botox? Should I really get fillers? What about having lipo? I mean, I guess I should just be lucky that I'm on this earth for another how many years, if that, and maybe I shouldn't chance it. What happens if there's a complication? I have the guilt because I want to look better.
At what point do you recognize that as the surgeon? How do you recognize that is a potential? Is it something before the surgery start, or maybe it's more from the surgery for the breast cancer? But at what point does that manifest itself?
Well, I think you start the relationship with the patient during the breast reconstruction process, and they see you as the breast reconstructive surgeon, not the cosmetic or the aesthetic surgeon. And I don't think as surgeons we really cross into the other realm. We're there to make them look whole, make them look functional again. So I haven't had a single patient ask me, hey, what about if I got elective lipo? What happens if we want to take some fat and put it in my face so my face looks less old or more rejuvenated? I don't really have had in my past that many women, or any women really, that's inquired about that. Just recently I had a woman in her late 40s who has undergone horrific cancer treatment, who came to my office for fillers and for Botox Xeomin, and she was really struggling with the decision to have those procedures, yet she's alive, and she should just be thankful she's alive. And at the end of the day, I told her, I said, what do you want? Do you want to feel better about yourself? Do you want to look more refreshed? Why not? What does cancer treatment have to do with that? You're going to wear clothes, you go shopping, you buy pretty clothes or pretty handbags. So why not look at this? Why make yourself have more guilt that's needed?
So they're actually putting the guilt on themselves and saying that they're not. And I guess what we're talking about is there's a difference, obviously, between the cosmetic surgery as compared to what could become physical necessities. So we're talking about, obviously, there's plastic surgeries for people who have birth defects or fire victims, burn victims. Obviously, those surgeries are medical necessities. but we're talking more of on the cosmetic side. How do you draw that line between the cosmetic side and what would be a medical necessity? Maybe the better question, and this is a guy stumbling through this, is there ever a medical necessity for the reconstructive surgery?
So that's a great question.
I'm glad I asked it then.
Yeah, no, it's a great question. So federal law in the United States is that women are insured for breast reconstruction, no matter what they decide they want in terms of a procedure. So medically necessary, some plastic surgeons will say to a woman, you don't need your breasts. And we can say the same, if we're going to use that analogy, maybe not all men need their testicles. You know, men like their testicles. It identifies them as a man. Women like their breast. It identifies them as a woman. So it's a gray area when you ask that question for a really kind of concrete answer. But looking at it, all women should have the ability to be reconstructed.
Absolutely. It's just fascinating that, considering what they go through with, as a result of breast cancer, and in most cases, that is actually something that becomes that becomes an issue. Mm-hmm. I've had many friends who've either friends who are husbands or even women that were victims of breast cancer and mm-hmm. had gone through the reconstruction. And it's just one of those things. It's kind of like the silent secret that you just never hear about.
Right.
What are the signs and symptoms for somebody, for the friend or family or the spouse, that should be looking for, maybe in that, if you have a wife or someone you're close to going through this? What is it that you should be looking for? Are there signs and symptoms? Is it similar to depression?
Depression is definitely a strong element that's associated with this process, both the actual cancer part and the reconstruction, of course. The women are not used to looking at their bodies. They're different, they're altered. And here they are for 40 or 50 years looking at the same person, and then a day after a major surgery, they don't recognize themselves. And that causes an issue for them. We usually try to advise them to have reconstruction at the same time so they don't see themselves without their breast, because there's been studies that show women that look at themselves after complete mastectomy and they don't see a breast, which identifiably is a woman versus a man, or a certain size breast, that it does alter their mentality and the depression becomes more severe. So we try to at least have something in that area, and it hopefully will slow the depression and will hopefully give them more guidance in terms of, what, they're whole, and that's not going to change, and they're going to look great.
Okay, we're going to take a quick break. When we come back, we're going to talk with Maria about when to begin that reconstructive surgery and the post-surgery monitoring and the issues that arise out of that. We'll be right back.
From the files of New York detective Frank Santasola comes a riveting murder mystery novel, The Garbage Murders. After an illicit liaison with his mistress, the owner of a private sanitation company in New York is murdered. His wife, aware of the affair, first believes it could be the motivation for the killing. But when her truck drivers are attacked by her husband's associates, family values get questioned. Enter the life of Detective Frank Miranda, one of a few men in law enforcement assigned to infiltrate the Italian mob and bring to justice some of the biggest names in organized crime history. Be taken into the world of an infiltrator and the personal decisions and sacrifices he made daily. Guaranteed to touch all your emotions: sadness, anger, love, and laughter. Available on Amazon Books in both paperback and Kindle editions.
TheGarbageMurders.com.
You are watching the Risk Advisor vodcast, and we're back with Dr. Maria Lotempio talking about post-surgery monitoring. So before the break, we started talking about reconstruction and the issues and the things that women have to make a decision on. Is that something that they do right away? Is that something that you wait and you go through a recovery period? What's the recommendations? What do you think?
Well, I advise all women, if you've been diagnosed with breast cancer and you're going to need surgery, you should see a plastic surgeon no matter what. You should get all your options out there on the table so you can make a complete decision. Regardless if you want it done immediately or delayed, you should have all that information to put the big picture together. And when you're going to a plastic surgeon for that reconstruction, you want to go to a plastic surgeon that's going to offer you everything. Everything being implants, everything being autologous tissue. Autologous tissue is using your own tissue from your body. Some women don't like foreign things in them. They've gone through cancer, they don't want anything foreign. So autologous tissue is a very good option. Not all surgeons can perform this particular procedure. So if your plastic surgeon is basically working with your breast surgeon, make sure they can do all those procedures, or at least make sure you know about all those procedures before making a decision.
How much conversation does the plastic surgeon who's going to handle the reconstruction have with the breast surgeon who's doing the mastectomy?
Well, the breast surgeon's really the first point of contact, and he or she is really the one that determines what the surgery is going to be, and pretty much gives at least the initial information to the patient in terms of reconstruction. And then we do see the patients afterwards, and we go through everything. We sit down, and the patient ultimately makes a decision what she wants, which could be, again, implants, autologous. So it's really that individual's preference.
And even in the implants, they have the difference between silicone and...
Generally, we'll do silicone for breast cancer patients because they don't have a lot of skin because their breast has been removed, the gland has been removed. So we want the breast to look as natural, but we also want the breast to feel as natural on that patient. So we usually use silicone.
So earlier in the show we talked about what a patient goes through before they come in to see the doctors and talk to them. When you finally get somebody sitting in front of you, what are the things that you're evaluating of the patient?
Their mental status, are they understanding what I'm talking to them about? Are they asking intelligent questions? Are they taking the process seriously? Are they being swayed by family members or another doctor? Or are they making a decision based upon themselves? I'm looking to make sure that they're healthy enough to undergo a procedure that can, depending on what they want, can be up to 6 to 12 hours. I'm looking to see what their coping mechanisms are. If they're going to have problems, are they going to actually say to the doctor, hey, I'm having a problem, so you can help them? Or are they going to stay silent? And a complication could arise that could have been averted if they were able to feel comfortable with their surgeon. So these are all things that we take effect and take into consideration during that first consult.
What should a patient do that's going to get ready for that surgery? What are the preparations that they need to go through? I mean, we've gone through the check, we've balanced, we've gone all of that. I decide you're the one that's going to cut me up. Let's go. Right?
Well, usually we do the surgery with the breast surgeon. So this is a group surgery, so to speak. The breast surgeon comes in, removes the breast, and the plastic surgeon comes in and puts it on. So in terms of the workup, it's very similar to what your breast surgeon's going to ask. Making sure we have our supplies, making sure the patient's healthy, making sure the patient knows, depending on what type of reconstruction option they're going to have. Is it a 1 hospital day stay, or is it going to be a 3 hospital day stay? What did they bring to the hospital? We have lots of information that we give to the patients to prepare them. Medications to take, medications they're not going to take, things to do before the surgery, things not to do before the surgery, common sense things. So we really spend a lot of time and really educate the patient so that they can go through the process and to really avoid any possible complication.
So we've gone through all of that. Now what happens with post-surgery? Do you find that, patients are going to, listen to, the golden word that you're going to tell them, or do you find that they kind of run off on their own sometimes?
Well, the breast cancer patients pretty much stay on target with what you explain to them. Some of them feel so good so early on that the big issue is they do too much, too fast, and that can cause complications. Sounds kind of awkward to say, hey, look, I feel great, let me do my normal things. But when you have major surgery, you do want patients to kind of take it easy for this first few weeks. But then you have the opposite, the ones that don't want to move, the ones that are, we say slugs, which is not really a nice name, but those are the other spectrum patients that we are concerned about. So those are the two types of patients that we're concerned about.
What about, patient goes home and all of a sudden wants to verify what you're saying and goes to WebMD and tries to figure out, what they should be doing in the recovery phase? How much of a problem has that become?
It's becoming more of a problem today. Dr. Google, Dr. Google's not doing the surgery. Dr. Google doesn't have the 20-year experience. Dr. Google doesn't know how to read patients. Dr. Google doesn't know about the skin, doesn't know about all the things that go into individual patients. Let me repeat that. Each patient's individualized. Dr. Google puts everyone in the same category. So all those complications and all those problems that you're reading may or may not be applicable to you. And that's the one thing that Google can be dangerous about.
Wow. It's interesting. Well, I wish we had a hell of a lot more time to talk about this stuff. But anyway, I'd like to thank you again for coming in. We want to give a special thank you to our guest. And before we do move, how do we get in touch with you? If people have questions, comments, and they want to get to you or come and see you as a doctor.
Great. So lotempioplasticssurgery.com is my website. My office number is 212-427-2020, 2020. Just look on the website. You can email us and or give our office a call and set up appointments.
Sounds good. If you'd like to if you want to ask a question or a comment, you can always write to us as well, and you can get us at questions@theriskadvisor.com. You could follow us on our social media accounts, and you could find all of those accounts at theriskadvisor.com. Once again, we want to thank you for watching, and we hope you tune in next week.
We hope you enjoyed this show. If you have any questions, would like to appear on the program, or recommend a guest, contact us at theriskadvisor.com. Follow us on Facebook, Twitter, Instagram, and LinkedIn. View and listen to us on iTunes, iHeartRadio, YouTube, and Roku TV. Tune in live on various local radio stations. Find links to all of these and listen to past shows at theriskadvisor.com. Thank you for listening, stay safe, and join us again next week for another episode of The Risk Advisor.
From the files of New York detective Frank Santasola, a riveting murder mystery novel, The Garbage Murders. After an illicit liaison with his mistress, the owner of a private sanitation company in New York is murdered. Enter the life of Detective Frank Miranda, one of a few men in law enforcement to infiltrate the Italian mob and bring to justice some of the biggest names in organized crime history. On Amazon Books in paperback and Kindle editions.
TheGarbageMurders.com.
TheRiskAdvisor.com.